Namaste. Now I am going to talk about community based palliative care. Community has got very important role to play in providing palliative care to patient. The faculty for this topic is Dr. Dinesh Kumar. He is professor in community medicine at Pramukh Swami Medical College, Karamsad, Gujarat. The objective of this talk is to define the concept of community based palliative care program, role of key stakeholders and examples of community based program. As you know, a patient who is suffering from life limiting illness or any chronic illness needs total care, a holistic care, which includes physical care, psychological care, social care and spiritual care. This is the simple diagram showing the continuum care a palliative care patient needs, and its palliative care can be started right at the diagnosis of the patient, and its role increases as the disease progresses. Then there is a period during which there is a patient, it is sure that patient is not likely to survive, it is called end of life period. Following death of the patient also, the palliative care team goes to home of the patient and provide bereavement support to the patient's family. The patient role starts from the screening, prevention of the non-communicable diseases up to the death of the patient. The role of caregiver starts from the diagnosis up to the bereavement support. The family as whole has a role to play from prevention up to the death of the patient, and community also play a very important role in prevention and then diagnosis and care of the providing palliative care and bereavement support to the patient's family. So, what is community based palliative care? It is a palliative care services are those run with the community participation. There are two types, community based or community owned services. A group of interacting organisms sharing an environment and common characteristic is the definition of the community. So, they are a group of people living in same area, same environment and has common characteristics. Their intent, belief, resources, preferences, needs, risks etc. also same. Common identity of people and degree of cohesiveness is there in community. Coming to community participation, the involvement of people in community to solve their own problem. At many places there is a group of community people who are contacted or who gives guidance to the whole community to solve their own problem. It is a very broad concept, and this group of community can solve any type of problem, whether it is a natural disaster or there is a health related issues in the community or any other issues. Simple feedback is major involvement in all the phases and areas of the program, and needs assessment, planning, implementation, resource mobilization, daily management and evaluation is required in this type of community participation. So, first of all, in any given community you have to find out the need assessment of this community, then you can plan a program, you can implement, you can give resources, mobilize the resources and manage it. Every member of community may not be equally contribute, but you have to identify the people who are who has got attitude, who has got knowledge, who has got skill to participate in the palliative care program. Attempt to actively involve as many key groups and individual as possible. You try to make a big group as big as possible, so many people can be involved. What is the rationale for community approach to palliative care services? Patient who is suffering from life limiting illness like cancer, he may be attending a hospital for his cancer treatment, but when he comes back home, there is a need for a continuous care and attention to the patient and family for rest of their lives. They need regular social, psychological and spiritual support in addition to the medical and nursing care. So, they need medical care as well as social and psychological and spiritual support. So, this type of support should be readily available at home only, in the area where they are living. So, it should be very nearer to their home. And this care should be integrated for all types of disease, not only for cancer, but suppose patient is suffering from renal disease, kidney failure, heart failure, liver failure, then also at all stages of this disease, community should be able to provide support. So, you should gather enough social capital in form of human resources or maybe in form of finances to provide a safety net to this type of patient and their family. And so, this will save the precious healthcare resources for acute care. So, patient need not rush to hospital every time there is some minor problem or some major problem. So, minor problems, if it can be solved in community itself, like a cancer patient, if I give example, a cancer patient needs dressing of the wound every day, and suppose patient's caregiver is a elderly lady, she is not able to do that dressing and does not know how to do it. A community person, volunteer who is trained in palliative care and doing this dressing, he can attend the patient at home. So, patient need not go to hospital or any other dispensary setup for the dressing purpose. So, this way you can save the healthcare resources, and these healthcare resources can be used for any other acute care or emergencies. And when the patient is supported by a group of community people, there is always better outcome of this patient. So, current palliative care scenario is like this. There is a at apex there is a specialist care which is provided by big cancer hospitals and big medical colleges hospital or district level hospital. Then there is a small role of primary health care center which is at the village level, and then there is a role of community. But if you select a community based palliative care, major role is played by community. In palliative care, community can take up so many work, so many care of the, so much of care of the patient that patient need not go up to the PSC or district level hospital. So, major role of is played by the community volunteers or group of people in community. The key players in this are primary healthcare workers. Primary healthcare workers, whether they are in PSC or in the community, they can play their role by giving palliative care to the patient, and then the role of specialist is come. So, the components of community based palliative care are medical component, nursing component, trained community volunteer and sensitized community volunteer. Few of the people who are sensitized, they are eager to work, but may not be having training. So, there one can go and there are group of people, they have taken some course and training in the palliative care. So, this type of people, so community workers or people from community who has got attitude to work for palliative care, they should be sensitized, they should be supportive and they should be given support to for their training and participative. They should be encouraged to participate in various training, hands on training, various group discussion and about the palliative care. Benefits of community based palliative care. There is a total care, it is a concept of total care where patients day to day problems are attended by community volunteers or group of people. It is affordable. Many volunteers do voluntary service and most of the time it is non payable or free services. Easy accessibility, the community volunteer staying just next door or within the area of the patient where she is living. So, what community has to do? They have to take up a social capital, they have to gather some maybe finances or maybe human resources. Secondly, they have to improve the skill of these human resources by providing them hands on training or a course or a exposure to this type of learning and empower these people. There is a process of empowerment of this volunteer in palliative care. So, the community becomes more confident, volunteers are confident and they become self sufficient and they can manage their own problems, they will try to solve their own problems. These are the community based projects in foreign countries and these are the projects in India, very well known and successful projects, community based projects in India. One is Chevela Mandal community based palliative care program in MNJ Institute of Oncology at Hyderabad. Another is Sanjeevani, a palliative care project in West Bengal. Then very popular neighborhood network for palliative care in Kerala and several panchayat run palliative care units in Kerala. In Kerala, there are almost more than 300 small centers, community based center to provide palliative care. And in this center, many a times that center is run by the villager itself. Alpha model is one of such model, where in Thrissur they have a link center where palliative care is given to the patient and it is managed by the villagers themselves. So, starting community based palliative care program, how to start? First of all, sensitize the volunteers, young people, people who are educated, people who are having some training in paramedics, people who are working in some healthcare setup All these types of volunteers can be selected, identified, and they should be sensitized. Then give them a training in palliative care, like nursing care, wound dressing, oral care, nasogastric tube care, catheter care, how to give medicine, how to talk with the patient, how to counsel the patient, how to solve help the patient taking them to hospital, how to help the family, also training is given. Then they can provide nursing services also, as I said. Then if that is not managed by the community, then only patient can be taken to the facility based services, that is hospital or a dispensary where patient is undergoing treatment. When patient comes back from the hospital and doctor has prescribed some medicine, doctor has prescribed daily dressing, he has been given catheter and doctor has said that catheter care should be done every day, then the role of community comes again. This patient can be given nursing service at community by trained volunteer and by sensitized volunteer. So, this type of program can be developed by empowering the community. There should be sufficient healthcare system, collaborative generalist practice and vision for the change. By the strong roots of these 4 pillars, we can have a build up of a very good palliative care services in community and in hospital. Then this type of community based services should be linked up with the healthcare system in nearby area. It should be linked up with the hospital or dispensary or a medical college in nearby area. So, these community volunteers are well aware about, they know everything about the hospital, they may be knowing the doctors and their service timings and all that. So, they can take up this patient to the nearby hospital whenever required. So, that will enhance their sustainability, it will cover the wider area of the community and it will be have a better multidisciplinary approach to the program. So, linked up with organization and institution based palliative care services, local self government institution, existing healthcare system in the region and social organization in the region. Some few NGOs also work for palliative care or cancer patients or kidney patients. So, this community based program should have link with such NGOs. So, NGOs also can support that community workers or volunteers. Key to success is first and foremost community participation. A big number of people from community should come forward and participate in this type of program. Quality assurance, the care and services provided by this group of people should have quality. It should not be haphazard. These people should be trained, properly trained and should have a right approach to the problem of the cancer patient or palliative care patient. Then there should be sustained continuous monitoring of this patient and this their community services. And this group of people should evaluate their services at every 6 months or 1 year whenever it is decided, and they can try to improve their services as per the advancement in technology and as per the need of the community. How you will evaluate your community based program? First is budget and allocation, whether you have sufficient budget and it is increasing, more and more budget is put into these services. Then standard operating procedure, logistics, then number of home visit done by this community group, whether regular they are doing regularly, and number of volunteers trained. Third indicator is output in form of number of patient receiving care and number of procedure performed at home, like number of catheter care is given, number of rice tube insertion is done, and all such thing. Fourth is you measure the outcome, evaluate the outcome, like satisfaction of the level of patient and caregiver, how well your services are taken up by the patient, and patient and caregiver are satisfied with your services, your nursing care, number of patient agreeing for this type of availing these services, and number of hospitalization which is avoided. Such minor problems, person should not go to hospital, and that problem is solved at home by community volunteers, then this is one of the indicator of evaluation. And what is overall impact on the community by this type of program? Overall improvement in quality of life of patient with life limiting illness. So, to sum up, family and community are important stakeholder. The whole community based program starts from the family and community people. Spectrum of community participation, how big is the spectrum of community participation should be as wide as possible, so that you can reach out to more number of patients, more home care services, and more number of services offered to the patient at home. It should be vital for providing total care. The services provided should be able to provide total care that includes psychosocial evaluation, counseling, communication, and support. And there are several local and international models exist. You can take example from them and keep them as your role model, and you can follow them or you can take guidance from them. So, palliative care is a holistic care, patient centered care, aim to improve quality of life, and it is done by interdisciplinary team approach and like professional and empirical, and by community based volunteers and community people. Thank you very much.